Welcome to the Healthusiasm podcast, a panel discussion on behaviors, innovations, and trends in health and self-care. My name is Christophe Choquet. I'm a global keynote speaker on the future of health and self-care business, and I'm also the author of the book called Healthusiasm. Now, if you're new to the show, you might wonder what Healthusiasm is all about. Well, Healthusiasm is the aspiration that we all have to be healthy and happy. And as a result of this, every company or organization is now more than ever focused on making their customers healthier and happier. And so, every month I discuss with a panel of experts the positive changes that are shaping our health and happiness. This is the first episode of the second season, and in the show, the panel will discuss if rewarding good health behaviors is something, nothing, or everything, and also what the Barbie movie means, or rather could or should mean for health and self care. And for this discussion, we have three of your beloved experts in the panel. Calling in from Barcelona is our digital health connector, Aline Noizet.
Hola.
Our American in Paris and medical expert in digital health, Aditi Joshi.
Hi, everyone.
And from London, customer experience and research expert, Krupa Sutar.
Hi, everybody.
This means we are missing our human experience expert, Mo Suina. But nevertheless, together we will today again amplify the health enthusiasms that we see in articles, new business ventures, or simply even in the world around us. So, tell me, Aditi, what are the health enthusiasms that you witness in the past month?
So I'm going to start out with something positive because I know that I have a tendency to think through things and look at how it's going to affect the health system in general. But we were talking about, well, a couple of things. Amazon Clinic launched. So again, Amazon is starting out to expand what kind of telehealth use cases they are using. But what I wanted to talk about today is that they've actually started expanding how they're using other parts of their clinic and clinical workflows. So one is using AI for scribes and workflow efficiency. So the idea is that they have a health scribe where they can generate clinical notes from the conversations that patients and clinicians are having. We've all been using ChatGPT. We all have experimented with Bard maybe as well and figured out how and what works for both our speech and what we write. And so it's interesting that we're going to be using that for clinical notes. I've tried a little, not with the AWS, but I've tried some other companies' clinical scribes, and some of them are actually really good. And I find it will be really helpful because a lot of what patients complain about sometimes is that we're not paying attention to them because we're typing or we're taking notes. And this takes away that problem. So you actually can concentrate on the patient without distractions and then figure out later the edits you need to do if it's really that good. So I find that would be really interesting. And then the other thing they're doing, which is not related to this, but really they're figuring out ways to store large amounts of medical images. So consider radiology images and being able to upload it. So generally, most patients don't really have access to those images. And even for clinicians, so when I would try to find radiological images, I would have to pop into another screen in another program. And this may take that away because it'll be in one place and it'll be able to store everything. And so people will be able to access not just the reports, but the actual images.
Yeah, super interesting. And I think in previous shows, we talked about how even Microsoft is using ChatGPT to do pretty much the same. They have this company called Nuance, and it would also do pretty much the similar things like transcribing patient interactions. And we noticed, I think a month ago in June 2023, the Mayo Clinic hinted at broader plans with Google Cloud, where they would want to do pretty much the same thing as what I think AWS is now offering as well. And what they want to do with the cloud that Google is offering, they want to unlock the sources of information and find new information, find new interpretations of the information and the overall very complex patient medical history, of course. And what was interesting, by the way, related to hospitals and the way that they use AI and all these types of services, whether it's coming from Microsoft, AWS, or Google, is that apparently the Wall Street Journal, they reported that Google is already testing its MedPalm 2 AI chat technology, which is basically the ChatGPT from Google, if you will. But it's been tested in the Mayo Clinic. or the Mayo Clinic, as some may say. So basically, as well, to although it's not even ready, right? But to do the same thing, to analyze data and to make sure that we can learn and maybe even unburden some of the administration in hospitals. By the way, I've heard that British National Health Services in the UK, Krupa, is giving 27 million in grants to adopt generative AI solutions in hospitals. So I think we'll see a lot of things happening there with AI in hospitals. But not everything is good with AI, right, Aditi? You can be negative now. Just
No,
go.
that's fair. Yeah, because I can't stop. I just want to make sure because we talk about AI a lot. And if you looked at everyone's feeds, LinkedIn, or any of
Mm-hmm.
the feeds where we interact, people are really excited about AI. But in the US, there's always this problem of what we pay for in healthcare. And so there's an entire system based on looking at what claims are happening and deciding whether they're paid for or not. And there have been cases where insurance companies are using AI and determining that this patient shouldn't have this paid for because technically they should be better. They should be better not by now based on this algorithm. And there are cases and many stories of people who were not better. They were actually worse and they needed more care. So there is this limit too that we don't necessarily know how all these algorithms work. We have to still look at individuals as individuals. And we certainly shouldn't pay for people if they shouldn't, deny paying for people's healthcare if they are still needing more care. And definitely not relying on a machine, but really looking at the patient, right? And this is what people are worried about, that it's going to become a machine that's telling me what to do rather than looking at me as a human. And it's already happening. And so we have to make sure that we're overcoming that before it becomes worse.
Yeah. We're not there yet, and it's definitely some things to keep an eye on. Just a funny note on AI. I saw I saw something passing by Andreessen Horowitz. We talked about him in the previous episode, but apparently somebody from the VC company was invited, and you're gonna love this, to be part of a panel, and the panel would talk about. And this is the title: How can AI be used with fax machines to unburden the administration in hospitals? Fax machines in hospitals, healthcare, and AI, and there's a lot to be discussed still, I think. But we're nowhere there yet. I think it's also the people from Google, even if it's tested in MedPalm 2 is tested in the Mayo Clinic, they say that we still need to learn a lot. And I think your fear is rightfully so, Aditi. But let's just look on the bright side. There's a lot of things that can happen with AI, and I believe that Apple is doing quite some stuff with AI as well, and more specifically with the Airpods. Aline?
Exactly. Yeah. So it was announced this week that Apple just filed a patent of what looks like AirPods that we know with biosensors inside that can track brain activity. So the electrodes would be in the earphones and they would measure biosignals and electrical activity from the brain. So we can imagine that the data collected from the AirPods could, for instance, tell us when we need a break, which music makes us more productive, and also detects early signs of Alzheimer's. So quite exciting.
Yeah, and totally. And it's really about how can we live better with ourselves? How can we optimize our own functioning? And that's a creative segue I made here because I want to talk about human functioning. Because the WHO came up with something new, an indicator to measure health, which is called human functioning. Apparently, and correct me if I'm wrong, Aditi, but I think there's two indicators that are commonly used to monitor health in populations or in society at large, and that is morbidity and mortality. So if we're talking epidemiology, we're talking about morbidity and mortality in general. Now, the WHO wants to add a third indicator, which is called human functioning. And the idea behind this new way of thinking, or maybe even this paradigm shift, is the following. They want to look at the combination of biological health and lived health. How do people function in society? In a way, it's like the value that health has on the individual, but also the value that health has on society at large, and even vice versa. How does society has an impact on health? And so the reason why they are shifting this focus has to do with the Sustainable Development Goals, the SDGs. These SDGs were set up by the United Nations, and basically the aim of these SDGs is to face global challenges together. You probably have heard of these SDGs. But one particular SDG, the third one, is about good health and well-being. More particularly, it says to ensure healthy living and promote well-being for all ages. And so the idea or the conviction by the WHO and many of the scientific people behind it is that if we only would look at morbidity and mortality, it would not be sufficient to achieve this sustainable development goal of good health and well-being. And that's why they want to add human functioning as a third indicator to monitor. I think it's a very interesting development. It might require a total shift in thinking. Rightfully so, it's called a paradigm shift. So I'm very curious to see what it will bring. But it could profoundly benefit, health practices, even health research, education, policy, it will require even a different multidisciplinary approach if we think about how this health has an impact on society and vice versa. Talking about society, something is happening in the UK, isn't it?
Yes. So, well, there was something that happened worldwide last week. So that was World IVF Day. And that was on the 25th of July. The World Health Organization, for people who may not know, the data shows that infertility affects 1 in 6 people worldwide. So it's an extremely difficult time, both emotionally and physically, for those involved. Anyhow, something is happening in Scotland, and it's to do with our King Charles. And what I was reading about recently is that he's established a dedicated team of fertility experts, but not just medical doctors. He has moved into including naturopaths, acupuncturists, and nutritionists. And for those who don't know, King Charles has actually been a long-time advocate of alternative methods. So, for example, he was long promoting organic farming, for example, and he's promoted that for the last 30 to 40 years, so way before many people were talking about it, and just generally holistic living. So this program actually will address a combination of natural therapies that he will work on with a number of his experts, which will include herbal supplements, dietary modifications, and stress reduction techniques. There'll be naturopaths on hand, nutritionists, and acupuncture too for the physical side of the treatment, but also he's incorporating emotional well-being, which we know fertility doesn't just affect the body, it affects your emotions too. So he'll have counsellors on hand as well. And what they're going to do is select 40 lucky women. I'm not too sure how this selection is going to be made, but each of those will be in Scotland, and they'll have comprehensive assessments to identify any potential barriers to conception, and then they'll have personalised treatment plans. So, for example, in a UK IVF, 1 round can cost around £20,000, and that's just the medical side of it. So that's obviously private, and that would be for a top-end clinic. And if you're lucky enough to have it on the NHS and it's being pulled, you may just get 1 round, but otherwise it's costing thousands of pounds. And then you have all this additional nutrition and whatnot on top. So the fact that these women are going to be offered it is just so amazing. And it's going to be really interesting to see what the outcome of this, because it could be really life-changing for anyone involved.
Yeah, I love it. And going from fertility and making children to actually innovations for children's health. I got one from Alba Health. It's a Danish-Swedish startup that is dedicated to providing digital gut health support for children. And they just announced that that they have secured about 2 million in pre-seed funding, which is quite a bit of money, certainly for pre-seed. But the reason why I think this is interesting is because there isn't so much innovation in child health, I believe. It's not that I see a lot, at least. And we know that gut health is already important. So knowing that they will focus now on gut health for children is I think, very interesting, because I think there's a lot of scientific support that we know that the way that people eat or children eat very early on in their lives might definitely affect their health outcomes later. So very interesting development in child health, a lovely innovation. Aline, you had another innovation for us to share.
Exactly. So it's also coming from the UK, from so researchers from the University of Leeds. I've been working on a tiny surgical robot that could transform detection and treatment of cancers. So starting with lung cancer, I think it's really good because we know that lung cancer is on the rise, especially amongst women, and that it is the highest cancer. It has the highest cancer mortality rate. So it's good news. So it's actually a 2 millimeters tiny robot that can travel deep into the lungs, and it's controlled by magnets, and it can treat the first signs of cancers. And it can actually reach the smallest bronchial tubes of the lungs. So I think it's fantastic news, can really make treatment more effective and more targeted. And the other use case that they were mentioning in that article is that after that, they could use it also for brain surgery, for more precise surgery.
It's amazing. I'm curious to see when it comes to market, because I've seen it a couple of years ago as well in a presentation by IMEC, a Belgian tech company, where they actually have very specific like nanotechnologies that can go into the blood and actually do similar things. So a lot of healthusiasm is coming our way indeed. I have a couple of weird ones to end with, or funny ones if you want. Real quick fire. Does anybody knows what the Paris syndrome is? Do you know what it is?
Yeah, I've heard of it.
So I don't know if did you suffer from it when you moved to Paris?
Oh, no.
Okay.
But I also don't glorify Paris in that manner, but I know exactly what it is.
So it's indeed, I mean, if people glorify Paris up front, apparently tourists are so disappointed when they arrive in Paris that they even risk to faint. So it's a funny thing. It's not an official disease. It's not on the DSM-5, but apparently it happens a lot, and definitely with Japanese tourists. So here you go. Something that you might not have known. Does anybody seen the latest announcements by Hims & Hers, the San Francisco-based telemedicine wellness company? They brought out some mints. So they're called heart mints. Any idea what they could do? They're actually, Viagra in mint form. So that's why they called heart mints, I guess. And then finally, as the last one to wrap things up here, South Koreans are 1 year younger since June the 28th. Have you heard about that? Apparently, in South Korea, the traditional practice of considering babies is that, I'll put it that way. The traditional practice is to consider babies 1 year old when they are born. But the thing is, that's the Korean age, and so in international standards are different. I mean, we saw that we're 0 years old, right, when we get born, and that's the international age. And so they now changed it back to the international age because there was consensus that everybody wanted to have the same age. So that, which means that basically South Koreans are now 1 year younger than they were considered previously. But it's even more complex because they also have a calendar age, which is everybody turns 1 year older on the first year of January. And that is the age that is used if you want to buy alcohol or nicotine. So 3 types of ages, which now they want to, switch to the international age, which we all use. It's not that they are healthier or that their biological age is 1 year younger, but legally speaking, they are all 1 year younger. And so it is. I thank you all for your healthusiasms. And it is in healthusiasm world indeed. I mean, there's so many positive changes that are making our world a little healthier and happier every day. If you want to know more about these healthusiasms, go to healthusiasm.com and subscribe to our newsletter. The healthusiasms from this show will be summarized for you into a monthly newsletter. And by subscribing, you will also have access to other exclusive content like healthusiasms that might not have made the show. Okay, that's it. Let's move to the next segment of the Healthusiasm podcast. Is it something, nothing, or everything?